Hey, you guys. Sorry, it's been a while since I've posted. I think it was December and now it's June. I finished nursing school. Yay! I graduated in May and my last 12 weeks, 16 weeks, 8 weeks was cardiac. It was intense and I loved it. The final was brutal. I got a B. I'm very happy. And then my last 8 weeks of school, I had a leadership class where we talked about the history of nursing, leadership, communication, policy, unions. We wrote our resumes and cover letters, talked about how to interview. And I also did a 120-hour preceptorship at a med-surg floor with a nurse. That was awesome. I got to be a real RN and use the electronic record system and document, administer medications, deals with psychosocial issues with my patients. It was great. I loved it. I miss it. Then when I finished that, graduated with honors. Yay! It was really fun. We had a pinning and it was beautiful. I got to carry one of the lamps, the Nightingale lamp, and a lot of my friends came. My husband and my 2 kids pinned me. It was really sweet. Then we had graduation the next night, and one of my girlfriends came, and anyway, it was just a hoot of a weekend. My husband threw me a party. Yeah, it was so cool. And then I took a couple weeks off and started prepping for the license exam. And paid for a prep course through Kaplan, and I'm using that to study. I take the license exam in a week, so I'm excited, a little nervous, but I'm just glad it's going to be finally get my RN. That's a big deal, so of course it is to all of you too. Yeah, right. When after I finished the prep course, I took a 3-day certification training and got my advanced cardiac life support, ACLS, and my PALS, pediatric advanced life support. And I got my IV certificate from a doctor who taught IV inserts. And he was very, very helpful on technique and gave me a lot of confidence to start IVs. And then I'm taking EKG online. So I'll be able to read strips if I'm on telemetry or in the cardiac unit. And let's see. Oh, before I finished school, I volunteered to take some assessment tests online through ATI, and I scored pretty well in the pharmacology and did okay on the rest of them. They're predictors to see if you pass the state license exam, and I scored high enough to have a good chance of passing, so I'm confident that that will go well. And I had one interview, and I wanted to give you just some heads up about. I had a behavioral interview where they asked questions like, "What is your greatest weakness?" And we learned in leadership class some techniques to deal with those kind of interviews. They also ask questions like, tell me about a time when you had a difficult patient. How did you handle it? So before the interview, I did my homework and I got on YouTube and I looked up behavioral interviews for nurses. And I watched probably 4 hours of videos and I practiced. I went through some of my memories about some of my patients and being in school and customer service and that type of thing, and I mentally made notes of different situations that might come up in the interview. And when I went into my interview, I was confident and relaxed and rehearsed, and that made a huge difference from walking in just cold. So if you are at the point where you're getting interviews, do your homework and ask the interviewer prior to going in what type of interview you will be in and how many people will be in the room, and try and look online for some tips and tricks. It'll help a lot. It really helped me. So I have my fingers crossed that I'll get a job soon after my exam next week. So what else? I kind of got my lab values memorized, the basic ones anyway. Oh, and learning meds. Most assessment trainings and the school's learning systems are getting rid of the brand names on medications. So learn the generic names. Learn your suffixes. For instance, LOL or OLOL. Anything that ends in lol or olol is a beta blocker. IPINE is a calcium channel blocker. There's so many. Learn your classifications. Cardiac meds, antidiuretics, high blood pressure medications, which would also probably be included in cardiac. Learn the classifications of medications and then learn the suffixes. And try not to focus on the brand names because they're getting rid of them. I don't know why. I guess they're trying to make it more difficult for us, right? The victim stance. So, thanks for the notes and emails, and thanks for subscribing. And if you haven't, go ahead and subscribe, and I'll keep posting videos until I'm a very old, crotchety nurse. I hope you're having a great summer. Thanks for listening, and send me some messages. Okay. Love you guys.